Welcome back to Wisdom Wednesday. Yesterday, we had a question about some liver lesions that were found on diagnostic laparoscopy, and this picture was shown. And the question was, what is the diagnosis? This is Fitz-Hugh-Curtis syndrome. The classic description of this is violin-string like lesions or adhesions between the liver capsule and the abdominal wall. So Fitz-Hugh-Curtis syndrome is one of the long-standing possible complications of pelvic inflammatory disease, which is often caused by STDs like gonorrhoeae and chlamydia. When these infections ascend through the cervix into the uterus, fallopian tubes, etc., you can get pelvic inflammatory disease, which is a very severe pelvic infection that can have long-term consequences. Sometimes we'll see this as tubal scarring or dysfunction when you're trying to get pregnant. Sometimes you can have ovarian or tubo-ovarian abscesses. Sometimes down the road, we will see this inflammation actually even out of the pelvis though, and that's what we see here, which is Fitz-Hugh-Curtis syndrome. So in a patient that presents kind of like gallbladder pain with red upper quadrant pain that's been persistent on and off for a long time, but normal labs, normal ultrasound, and normal imaging, think about if they have a history of pelvic inflammatory disease or even just a remote history of gonorrhea or chlamydia, and this may actually be Fitz-Hugh-Curtis. I hope you learned something today. See you next week for another trivia question. Share with a friend and follow along for more OBGYN knowledge.